All right. Hello, Dr. Shakir. We have you here. And before we get into the technical stuff, we'll get into that later.
Yes.
So first, I would want to ask you, how would you explain your job to someone who has no clue about it? Like a person who has no knowledge about anything, how would you tell what is that you do for a living?
Okay, so my name is Dr. Shakir Tabrez, and I am a urologist. Now, let me start off with the more difficult part. Whenever I say urologist, often people forget the U and hear neurologist.
Oh.
So at weddings, I've had people come up to me and ask me, I have a headache, or I have some problem with my ear. Then I tell them I'm not neuro, I'm like Euro. I'm down there. So essentially, urologist, the simple version of it is study of urine. But then there's a lot more to it. So I can take it like anatomically. For example, starting from the kidneys are way back here. That is where the blood gets filtered, creates urine. So essentially urine is a waste product. But the kidneys do a lot more than that. I mean, as in they filter blood and they create red blood cells, hemoglobin, which is necessary for all of us.
Yes, correct.
They also excrete excess water from your body. They are important for maintaining blood pressure, for your bone strength. So all of these. So in the kidney, there are issues which can happen, right from developmental problems, like when there's a baby or a child, they can have problems, or as an adult, they can get cancer in the kidney. So as a urologist, I'm a surgeon. A nephrologist is somebody who treats kidney issues with medication. A urologist is one who does surgery. For example, there's a cardiologist who gives medications and does angiograms. There's a cardiothoracic surgeon who does valve replacement, bypass surgeries and all of that. So we are the surgical side.
Okay.
So, and for that, I had to, after my school, which is 12th grade, I was in college for 11 years for this. So there was
Nearly
5.5
decade.
Much
More
longer.
than a
Most
decade.
of my friends were married with children and I was still studying. And I had to do my MBBS, 5.5, then MS, 3 years, then MCH, which is super specialization in urology. So after the kidneys, so in the kidneys also they can fail. So that's called renal failure. And when that happens, it doesn't mean just one. Both kidneys have taken the hands off and they said, I'm done for. So in those cases, the blood is not getting filtered, all the waste products and the toxic waste is staying back. So we need to do something for that. So dialysis, leading on to renal transplant. So this is with the kidney. So right from the kidney going down to the bladder, there can be cancers there, then the prostate, and there are so many problems that can create in a man. And then there is the external genitalia. So when it comes to that, we also are andrologists, meaning men's sexual health. That is also something we deal with. So men's sexual health it could be impotence, which means the person can have problems with his erections. Or it's called infertility, where he's unable to conceive a child. So these are all issues. And all of these can be dealt with in certain spaces with medication, certain spaces with surgery. And this is where we come in. So this entire gamut, right from the kidney, the adrenals, which cap the kidney, all the way down to the bladder, to the prostate, and the exit point, the tissues surrounding it, the external genitalia, all of these are what we work with. And it can be in children, in women, in young men, and in old age people. So this is all that encompasses what we do.
Okay. So I have a follow-up question on that. So I have read, I believe it's everyone knows this, that people say that your body can function also on one kidney.
Yes.
When you said that when kidney failure happens, usually it happens both the kidneys fail. Can you explain how does this one kidney thing work?
So that's the advantage of most paired organs in our body. When there are two, it doesn't shut down. One can help take care of it, and especially the kidney. So the kidneys are paired organs, and it's like two brothers working in tandem to support the house. That's what it is. So if one brother for some reason migrates or he just goes jobless, the other kidney is the other stronger brother who takes up all of these and works harder. So there is a process which happens called hypertrophy.
Okay.
Like if you keep training one bicep and you leave the other, this one will grow,
Become bigger.
and then this one will just go lean or waste away. Like that, this kidney, because it's doing all the lifting, it becomes bigger, but it does the work of both kidneys together. There have been people who have been born with just one kidney, and they don't even know it till they're in their 60s, and then they do a scan, and then they're surprised that they have one. Or those people who donate their kidneys to their loved ones, right? So they live with one kidney as long as they take care of themselves for a long time. So that's how one kidney can still help you survive through life.
Okay, coming down to the interesting part of this podcast. That's something that you specialize in.
Yeah.
It is robotic surgery, which we are going to be talking about today. So again, I would rephrase the question the same way I did the first one for your introduction. How would you explain robotic surgery to a person who has no clue? For example, I'll give you an instance.
Yes.
When I was excited about doing this with you,
Yeah.
so I had a conversation with my friend in one of my peers, and I was like, robotic surgery is going to be the next big thing, because I had done some research as well on these topics.
Yes.
So then the first thing that he tells me was, what does the doctor do then? So what does the doctor do?
Yeah.
Because the picture they have in their head, because of AI and robots and everything, is literally one chitti standing there and doing surgery on you.
Yes.
So can you explain this? How does it actually work?
So this is the biggest misconception, and it's not just the peer that you're talking about. I know of so many doctors who actually do surgeries who haven't had exposure to robotic surgery believe this. But okay, it's like this. So let us go through the evolution of surgery for a while. So
sure.
Evolution was, if there's a kidney here and the kidney had a stone.
Correct.
Even 25 years ago, and I go to Africa to do surgeries, even there, I see such big cuts. Here all the way, some 20 centimeters, 30 centimeter cuts to reach the kidney.
Okay.
Now, that is how it started. And even now practiced in so many places which are not advanced yet. Then it came to laparoscopy. So laparoscopy, now laparos means abdomen.
Okay.
Scopy is looking in. So you're looking into the abdomen through small incisions. They are just a centimeter in the body instead of a 30 centimeter one. Like that, there are 3 or 4 through which we put in a camera and instruments and work it from the outside. So you're watching a television where this is being beamed up, somebody is holding a camera for you, and with your 2 hands, you manipulate these instruments.
Okay, so they're like an extension of you.
Yes, they are. But this one, the disadvantage is these instruments are straight like this.
Okay.
And if you can imagine, this is the tissue or the body wall through which they go. So if they move around, this tissue gets stretched. When it gets stretched, it's painful. And there's only limited movement you can have with this straight instrument. So that was the limitation of laparoscopy. This moved on and it evolved into robotic surgery. So robotic surgery, the origin happened because in the 70s and 80s, the US military, they had all of these soldiers injured and lying in the battlefield, and they couldn't reach them to do surgeries or to take care of their health, those accidents or trauma that they had endured through. So they created robotic surgery. So DARPA, which is the Defense Academy in the US, is the one who created it. Then they licensed it to a company called Intuitive.
Okay.
And they came up with a robot called Da Vinci. So robot in essence was a word from the Czechoslovakian word for slave.
Okay.
So that's what a robot means. This came out in the 1920s. So the robot, essentially what it does now, as in it evolved from the 80s, 90s, it has evolved to something amazing right now. So these small 1 centimeter incisions, through that we put in arms. Okay, and in these arms, we will show you videos soon, where they can move. They have almost more degrees of rotation than a human hand.
Okay.
So now it is not driving itself. Imagine a car. Imagine your best Bugatti or your Ferrari or whichever you think is best. Now, this car with all its technology still cannot drive itself.
Yes.
It needs a driver. So essentially, a robot is an extension of me. What I do, it mimics inside the patient's body. What I do, it replicates inside the patient's body. So now what is the advantage? Because I sit in a console, right? And my eyes are placed into a viewfinder.
Okay.
This can magnify everything 40 times. So even the smallest of cells, I can see it so vividly and clearly. And then with the instruments, I can move it and it can hold tissue, cut tissue. Precision is that good with the robot.
So the margin of error is way less.
Almost negligible. And also, if you remember in laparoscopy, I said it moves all this way.
Yes.
Here, this is fixed. The movement happens here.
Inside.
So the pain is also much lesser. So that way, magnification, precision, and the ability to, do the most difficult dissection with ease, that's what a robot does. And you cannot feed in an MRI. You can't feed in a CT and allow the robot to do it. It can't, it's not that advanced yet. It's a surgeon who's controlling the robot every step of the way.
Okay, that's very interesting. Okay, one question I have is that, for example, I'm supposed to get a robotic surgery done.
Okay.
And I'm a very busy man.
Yeah.
And I just have to get this surgery and get back to work. So, in comparison to a traditional surgery, if we compare the two, how fast can I finish it and get back to work compared to a traditional surgery?
See, the most important problem or the recovery after a surgery of any kind always gets hampered because of the pain. And why is the pain more? Because the incision is bigger.
Is huge.
So the cut is bigger, so it takes longer to heal. Chances of infection are more, hospital stays longer. But this is just a centimeter. And the pain is significantly less. We've had patients after major surgeries who used to be in the hospital for 8 days, 10 days, go home on the second day after major surgeries. So if the pain is less, you're mobile faster, you get up and you walk around faster, you eat food faster, and you're home faster. The whole idea in the world of minimizing surgical incisions, of doing surgeries faster, is for people to go home earlier, right? So that, for a busy person, it's significantly more because he goes back to the family, he goes back to work, productive work, and the nation as a whole benefits from that. So that way it's very
more efficient
and very impressive that way, what it does.
So for example, if there are multiple surgery, I'm sure, in urology, where they're as you said in the beginning, we go from all the way down, everything we take care of, infertility and etc. So is there any particular surgery in which robotic surgery is not recommended?
The thing is, surgery or robotic surgery, I'll tell you one or two where it is so impressive that it helps a lot. One is when it comes to kidney tumors, right? So a tumor in the kidney is most often cancerous. And it does not come with symptoms. It's like most of these diseases don't jump out and yell saying, I'm here, right? So while doing a health checkup, you pick it up, there's a small tumor sitting there. So when this tumor is found, earlier about 10-15 years ago, you used to remove the entire kidney.
Okay.
Right? If there was a tumor, the entire house had to go. I mean, only that room can't be moved. But now with robotic surgery, with the precision, you can focus on the tumor, and there are so many ways to even prior to that, you can, with a VR headset, with AI integrating the images, you can actually do a pre-op visualization, and you can actually go through the surgery like you're doing it live before you do it, so you know exactly how it goes. So when you're doing the surgery, you know where the tumor is, and then you can slice out just the tumor with some normal tissue around it, and you can leave the rest of the kidney behind. This is a major benefit with robotic surgery. Same way when it comes to the prostate, right? The prostate is a small gland. It helps in reproduction, right? So the specifics of which we can talk about later. So between the urinary bladder, which holds all the urine from the kidney, from this reservoir, before the urine heads out through the passage, there is the prostate gland.
Okay.
Now this, when there is cancer in this gland, there are lots of nerves around it. So when the tumor, including the prostate, is removed, these nerves get damaged.
Damaged.
And these nerves are important for two things. One, they preserve the ability to control urine. See, when we have this ability to control, when we want to go to the washroom, you just hold. When you go, you go. Here, if these nerves are damaged, they don't. So the person is constantly leaking urine. So life itself becomes a problem. These days, medicine and surgery is not just about life, it's also about lifestyle. That shouldn't get hampered. So these nerves, when they're preserved, they preserve continence, which is the ability to hold urine, and they preserve the ability for a person to have erection.
Okay.
Both of these are necessary for any man at whatever age, right? So these, not just dignity, but humanity, lifestyle, so many things. So that is an advantage. Now, when you ask me about this, so most surgeries in the abdominal cavity can be done with the robot. Like almost everything can be done. But in an emergency, when there is a lot of bleeding which happens suddenly inside the body, for like there's an accident and there's blood, you do something called docking the robot, meaning you take about 10-15 minutes to position the ports in, and through that we put in the camera. So that cannot be done in a hurry.
Emergency.
So that time you have to do what you can to save the patient's life, stop the bleeding, then stop the cause of the bleeding and save the life. So at that point you can't do a robotic. Or if the person has undergone multiple surgeries before, everything is stuck inside, you can't visualize. That also is difficult to do a robotic surgery in. Possibly in time that might change. We have done surgeries with adhesions, we call it, where everything is stuck. We still have done that, but still, you would prefer traditional, conventional. You convince the patient that this is why we are doing it and go ahead. So in an emergency or with lots of adhesions or infection, only then do you take a step back. And the third possibility is if the tumor is large, if there's a cancer of the kidney, of the intestine in other fields, if it's very big, you remove the tumor through an incision. So for that you need an incision. So those times you feel you would rather do an open or a traditional surgery rather than this. So those are the times.
So this is very new into the doctoring world and everything. So it must be very expensive because the innovation is of that level gone into this, and the precision is that high.
True.
And since it's so beneficial to the individual, and it in a way helps the country in a way.
It does.
So how many years do you feel it will take for this norm to break of robotic surgery and robos being available, the supply being huge and being available in every hospital at one point?
See, now any technology when it comes in is expensive.
Yes.
When it newly is into the market, and also you should remember what I told you, Intuitive, or the company that the DARPA sold it to, they had a monopoly till the late 2018, 2020, till then they had a monopoly. So which means no other manufacturer could manufacture a surgical robot. Then slowly other companies started coming in, and today we have something called the Mantra. It is an Indian made robot. So the cost is 1/3 the cost of the traditional American made robot. So it has come down significantly. And when the cost of the machine comes down, we can transfer it to the patient also. Right? So like for example, when laparoscopy came out, it was very, very expensive. Now it is there in every hospital, no matter what size of the hospital or how many beds or how good the surgeon is, they all do laparoscopy. Similarly, the robot has started stepping itself down cost-wise. Insurance stepping in and recognizing that robotic surgeries are the way of the future. That allows more and more patients to take advantage of this and get it done. So, as we speak, we have each country having their own set of robots. Korea has a few. China, as you know, has a few. Japan has a few. Of course, the West and Europe have many. So like that, India has its own Mantra from Delhi, and they have a few installations in the country. So that way, the cost is coming down. It is being transferred to the patient so that he benefits from the surgery. So, but if I had to recommend robotic surgery to a close friend or a relative, a surgery, I would say please go ahead for a robotic surgery. It's that good. And also, I also feel when a surgeon is comfortable doing a surgery, that benefit translates to the patient. So if I'm doing it like comfortably sitting down, see, when I'm doing a robotic surgery, I don't have to wash, gloves, stand up, and most important, I can do sitting down, my hands are resting, and then I'm doing the surgery. So my fatigue doesn't get translated there. And if all of us are human, so we get some tremors when we are operating after a while. Say I'm doing a 3, 4, 5 hour surgery, the tremors are completely demolished at this point itself. So they don't get transferred to the instrument or the patient. So these are all pluses which we never can have in any procedure.
Okay. Is there a future where the robo understands the anatomy?
There's a possibility. But the problem with that is, like I was telling you, in one person, if you have to operate on both kidneys, even though it's in the same person and they're paired organs who are supposed to be twins, they are non-identical twins. When you get into the nitty-gritty, it'll look completely different from the left and the right are completely different people. So you can't apply the same thing. So what you're saying is right? From whatever all these AI engines and machine learning, one thing they have also been doing is they analyze all your surgeries. And once in a while, when you check in with the system, it gives you a report as to what you could have done differently.
Okay.
So, but it's based on a database of many surgeries. But when you individualize it, even if you go into DeepSeek and ask that question, can robotic surgery be automated? It'll tell you this, that it's not yet there. Meaning, it can happen, it's a possibility, maybe in, when you guys get there in your 30s and 40s, it might happen, but not for the next few years for now, because each person, each anatomy, each pathology is so different and it's dynamic. That's another thing. So it's not a fixed situation. So it keeps changing. Suddenly there's a blood vessel, there's a thing, and if a blood vessel gets hit, see, one of the most important things which I've realized is, beyond the whole surgical or dynamic factor, there's an ethical factor.
Yeah, correct.
Imagine like you trusting a machine to do something like removing a cancer from your body, number one. Number two, if the machine goes wrong,
there is no accountability.
Who will you blame? Is it the company? Or is it the programmer who's put in the program? Is it the hospital who wants the machine? So that, because of ethical considerations, besides the anatomical considerations, it's going to take some time before that happens.
Okay.
Yeah.
Okay, we'll change the segment.
Yeah.
We've learned a lot about robotic surgery. So I'll just ask a simple question on kidneys.
Sure.
So as you said, people don't understand if there's something wrong with their kidney until it's too late or until they have some problem which is showing.
True.
So are there any things in the day-to-day life that people are unknowingly doing, which is harming the kidney in some sort of way, or knowingly doing?
Okay, yeah. See, often what happens when I'm in my OPD and seeing patients, I sound like a salesman from Bisleri or Aquafina. I'm like, drink water. But that's the most important thing which people don't do. We assume we drink fluids, right? So we don't. And water is the fuel to the kidney. It's like you have a tank which is almost empty and you want your car to run, the engine will burn up. Similarly, the kidney needs the water to make what it does. I mean, for the filtration, to filter the excess waste products out, all of that it is necessary. So, water we don't drink. So, that is one. Today's foods, I love my fast foods, but then saturated food is high in sodium. I sound like an old, like one of those old geezers saying this, but honestly, I have seen this happen. When you have too much of that can elevate blood pressure, see, everything in moderation. So when patients come to me and we give them a chart for stones, for example, they get kidney stones, right? So I give them a chart, it says everything. They can't eat anything if they see that chart. So I say, eat everything, but in moderation. You can't have red meat 3 meals a day. People have it, but you shouldn't. So have it once in a while. And when you work out, or when you're building muscle, you need protein.
Correct.
So those times you can take protein. Whey protein is still okay, as long as it's not in excess. And drink fluids to flush it out. So another question is, how much fluids?
Yeah, I was going to come to that. How much water is
good enough?
Good enough. Because I read this article where they were like, the person drank so much water that it was very funny. He drowned from the inside or something.
It can happen. That is a possibility. So now, how much water is, if you go scientific, it's about 30 to 35 ml per kilogram.
Okay.
So a person who's 70 kilograms needs between 2 and 2.5 liters. But the simplest way is, if you're drinking enough fluids, you'll know by seeing your urine. If it's clear, you're drinking enough. But the goal is 2 to 2.5 liters in a day. That's the goal, and it can be anything. What happens is, when you're drinking water, you get bored of it. You get irritated with it. You can replace it with lime juice. You can have tender coconut water. You can have some fluids, flavored, non-sugary, which can help you to do all of this. So, how much water? As long as you're comfortable. How much food? As long as you're comfortable. And as long as you're working out.
So, I don't know if you've heard of this man. His name is Brian Johnson. He's blown up on Instagram in the past year or past 6 months. He is trying to reverse aging. Have you heard of him?
Yeah. He walked out because the AQI was high in Mumbai.
In Nikhil Kamat's podcast,
Correct.
he goes, "Can I wear a mask?"
Correct. And then even with the mask,
he walked out.
Correct.
Because because apparently I've seen this, he walks with an air filter.
He does.
Everywhere he goes. And I read this article, and he was saying that there was a research done by a agency or a doctor where he took 2 rats, an old rat and a young rat, sewed them together.
Okay.
And the older rat became younger for some reason.
Okay.
That's what the research said.
Okay.
So he took this and he was like, how can I replicate? Obviously, I can't sue anyone to me. So he did plasma transfusion. He took plasma from his son and put it in his body, and he took plasma from his body, gave it to his dad. So, and he takes 50 pills a day, 100% sleep score. He does 6 hour. He eats in a 6 hour window, fasts for 11 hours, and sleeps. I feel if you burst crackers outside his house, he's not going to get up. So what is your view on this? What do you think about it?
See, I have definitely heard about, because, I mean, you're living under a cave if you haven't heard of him these days. So I think what it's called is Operation Blueprint, the planning he does. So essentially what I think is, most people think what Brian Johnson does is he's working towards reverse aging. See, what we've come to understand is, compared to even 20 years ago, people are living longer. When I was doing my medicine, I would say when a patient has cancer and they're 65, 70 years, we'd be like, let's not do too much, let him just. But now I see so many wonderfully young 80-year-old men, right? Young in terms of youth, in terms of vigor, they'll give us a run for our money. The way they walk, they present themselves, their thoughts. So as age is going, it's not about the number of years in your life. It's how much life is there in those years. That is what everybody is working on. So when it comes to Brian Johnson, I think it's not just about reversing age, it's about optimizing everything. It's about slowing down age. So how he does it is, he just optimizes sleep, he optimizes diet and exercise. And there are 2 or 3 things he's been working on. One is, there are cells in our body which are called senescent cells.
Okay.
These senescent cells, when you say somebody is senile, right?
Correct.
So like that, senescent cells are the cells necessary for aging. So there are medicines called senolytics. Lytic meaning break. So these cells will break those senescent cells and they will arrest them so you don't age. That's one place the research is going on in. The other place is called epigenetic reprogramming. So big word. The cooler version is, they take your genes and reprogram them.
And do what with it?
And stop the aging process.
Okay.
So this way, you are where you are and you go forward with that. So these are all things his Operation Blueprint is putting in money into. But look at it this way. If you, as in your age right now, right? So you eat healthy. You indulge once in a while, yes, but you eat healthy. You work out regularly. you drink adequate fluids, do your health checkups at times, and control your life and lifestyle, that is what is all about. You optimize health. So what he does is optimize health in fancier ways. Whether all of these medications, genetic reprogramming, deleting certain genes from your body, all these will happen. It's a way of the future. But for now, what can we do? Do this. Just eat healthy, live healthy, stress-free. That's the most important part.
Another thing I saw was there are athletes, like for example, if you take Ronaldo or in the NBA, LeBron James and stuff. I don't know how far I'm right. I'm just shooting off a faint memory I have of what I read. So there was this article which said these people keep their bone marrow in some place, in some facility. So whenever they get injured, they just inject the bone marrow in the place of the injury and they recover way faster to play again.
Right.
Because their time is money. They need to play and to earn. So is that actually a thing?
I'm not too aware of this part, but the whole stem cell, right?
Yeah.
You've heard of stem cell and all that which goes on with stem cell. So stem cell is a baby cell. See, as a baby, you could grow into anything. You could become a pilot. You can become an F1 driver. So it is open to all opportunities. So a stem cell is like that. This is a cell which hasn't found its way yet. So it can become bone marrow. It can become a heart, muscle wall cell. So stem cells have the ability to regenerate or grow or become anything they want. So using these cells, they can regenerate tissue. So that is probably one of the reasons that that is there. For regeneration, tissue growth, I mean, there's a lot of micro stuff in that, but this is what I think it could be.
To wrap up this podcast, I have two questions. I'll ask you the one after that.
Yeah, sure.
So the first question is, what would you tell a person for better kidney health, better to get your waste out more perfectly, and just a better kidney health in general? Any tips or anything like lifestyle wise?
No, it's, to be honest, values on blood tests. People take it so seriously and so much to heart that itself brings in stress and causes problems. So we always tell our patients, when you smile, your kidney smiles. So when you're actually non-stressed about these things, because for example, kidney function is measured by this test called serum creatinine. So it's a blood test. So if it goes up a little, they get so flustered, they start looking for kidneys and kidney transplants and stuff like that. I'm telling them, it's a value. As a doctor, I don't treat numbers, I'm treating the person.
Correct.
Right? I don't want to treat a value. I mean, of course, we'll get to it. That is important, but that's not everything. So stress plays a big role. So work on, everything else you can quantify. For example, a diabetic, when he comes into my OPD, medications, you know how much to take. Food, you can be specific on what you want to take. The third part is medication, this exercise. You know how much to walk, or how much cardio, how much weight training, all of that. Stress you can't quantify.
Correct.
So, and that is a factor that affects every cell in your body. For example, even because we were talking about robotic surgery, the miniature incision, it brings down the stress on the body. Correct. It brings down the inflammation. Inflammation is your body trying to react to various stimuli. So when the inflammation is less, your body heals better and your body is in a much more stable state. So that way, stress is a major factor. Besides that, it is only, most importantly, please, everybody should do their health checkups at regular intervals. As in your 20s and your 30s, you could do it maybe once in 4-5 years once. But beyond your 35-40 mark, almost every year or every 2 years is necessary. Because another important thing which I'm telling to every patient of mine is absence of symptoms is not absence of disease. You don't feel anything doesn't mean it's not growing inside you. Sometimes diabetes is worse than cancer. Many people get alarmed when I say this because cancer, it's in one place, you can do a surgery and remove it. Diabetes affects every cell in your body and it's there for a lifetime. There's no stopping it.
There's no stopping it.
So that way, it's very necessary that we do health checkups. control the disease before it starts controlling you, adequate fluid intake, good mixed healthy nutritional food and exercise. That is, I think, a rule for every organ in our body. I think that's all there is. Simplify life. That's all it is.
Okay, the last question to finish this podcast. What would you say to a patient who's is neglecting robotic surgery? Anything that you would say to them that will convince them? I know you've said a lot about the plus points, but to tell to a person who's like, because see, I feel if you're against it, you're either completely against it or you're completely with it. There is no in the middle over here.
Correct.
So what would you tell them?
For podcast reasons and for the people who are listening or watching, I'll be honest that again, I will say the same thing. If a person had a choice to undergo a surgery, and it is expensive compared to your traditional or your laparoscopic surgeries, but costs are coming down. But if you had the resources to do that, please avoid even looking beyond it. Just, it is the surgery to undergo. And most patients, you know what they ask me, I mean, almost every patient asks me, if this was going to be your father or your brother or sister, would you recommend it? This is something which they ask us that. And I would be honest, in my mind I'm thinking, why do you bring that in? But to be honest, I say I would do that. I mean, I would say if it was for me, I wouldn't think beyond it. I would do robotic surgery. That's the most important part. Most people want to hear that. You know, would you do it if it was your relative? I would say yes, without batting an eyelid. It's a yes. And it's a yes which comes from within, because I have seen kidney transplants. Now, kidney transplant, I'll tell you, is when you place the kidney inside the body, the cut goes from here to here. It's such a big cut, almost 20-25 centimeters. And a patient is in the hospital for 10 days. 95% of the transplants in the world, even today, are happening with this big cut. But we do it through the robot. So we make a small 6 centimeter cut and we place the kidney inside and do the connection, like blood vessel to blood vessel. We do it with the robot. And it's beautiful. And the patient goes home on the 5th day. Much lesser pain. The kidney looking and functioning beautifully. So all of these are benefits which I'm seeing, and the patient is happier, faster, return to life, return to health. Patients who come in from abroad are back in their country very soon. These are factors which nothing can come equal to unless something else comes in.
Yeah, correct.
But till then, this is the surgery for today and for the future.
Okay, I think that's about it. Thank you, doctor, for
Thank
giving
you.
us so much perspective on robotic surgery
Thank
and
you.
changing our chitty mindset away.
No, your questions have also been quite interesting, honest, and I feel necessary.
Yeah.
Right. And for anyone, if anybody is watching or hearing, if they want to ask, they can always shoot their questions, and then on wherever we are,
Yeah.
and we will reply to them happily without qualms.
Of course.
Thank you.
Thank you.